Welcome to WoundCasters by Wound Care Today. I'm your host, Felix Boecker, and today we're diving into a significant issue in wound care, the potential for overuse of wound debridements. This topic has recently been brought to the forefront by a major legal case, which we will discuss alongside looking at clinical research on debridement frequency and outcomes. So let's begin with a concerning development highlighted by the U.S. Department of Justice. Our primary focus for this segment is a press release from the Office of Public Affairs of the U.S. Department of Justice dated April 4th, 2025. The document announces that the United States has filed a False Claims Act complaint against Vora Wound Physicians Management and its founder, Dr. Amit Vora, alleging they caused the submission of false claims to Medicare for overbilled and medically unnecessary wound care services. According to the complaint, Vora is a large specialty wound care provider contracting with numerous nursing homes and skilled nursing facilities nationwide. Now, disclaimer, I used to be a Vora wound physician when I first started in wound care, and I can attest to this statement. The Justice Department alleges a nationwide scheme to falsely bill Medicare for surgical debridement procedures to maximize revenue, even when the debridements were not surgical. The complaint outlines three main ways this alleged scheme was pursued. Number one, a proprietary medical record software. Vora allegedly created an EMR system programmed to bill debridements as surgical procedures, even when they were not. Number two, hiring and training of physicians. Vora reportedly hired physicians without specific wound care expertise and provided training that omitted relevant Medicare payment rules, intentionally blurring the lines between surgical and non-surgical debridement procedures. And number three, corporate debridement targets. Vora allegedly set corporate debridement targets based solely on revenue goals, pressuring physicians to meet these targets. As a result of these practices, the complaint alleges that Vora caused the submission of claims for surgical debridement services that were not medically necessary and used billing codes that represented more complex procedures than were actually performed, a practice known as upcoding. Furthermore, the complaint states that Vora's EMR software was allegedly programmed to improperly apply the modifier 25 billing code. This code allows for charging Medicare for an evaluation and management, or E&M service, on the same day as a surgical procedure if a significant, separately identifiable service is performed. The DOJ alleges that Vora's EMR automatically added modifier 25 to E&M claims without considering whether it was appropriate, leading to claims for E&M services that were not payable alongside surgical debridements. Now, it is important to remember, as stated in the press release, that the claims asserted in the government's complaint are allegations only, and there has been no determination of liability. However, this legal action brings to light significant concerns about the potential for financial incentives to influence the use and billing of wound debridement procedures in clinical practice. Let's shift our focus to the clinical evidence surrounding wound debridement. A significant study published in JAMA Dermatology in 2013 investigated the frequency of debridements and time to heal in a large data set of over 312,000 wounds. This retrospective cohort study concluded that more frequent debridement was associated with better healing outcomes and shorter healing times. The authors of this study explain that chronic wounds often become trapped in the inflammatory stage of healing, and aggressive debridement can transform these chronic wounds into acute wounds, promoting complete healing. Debridement, defined as the removal of necrotic tissue and foreign bodies from the wound, is crucial for initiating the clotting process and subsequent stages of healing. Now, As highlighted in a Stat Pearls resource on wound debridement published in 2023, the primary goal is to remove all devitalized tissue, including necrotic tissue, slough, bioburden, and biofilm, to encourage wound healing. Devitalized tissues can serve as a nutrient source for bacteria and act as a physical barrier to reepithelialization. Another narrative review published in the Annals of Medicine and Surgery also emphasizes that debridement is a critical step in wound bed preparation that aims to promote the production of healthy granulation tissue and speed up the wound healing process. Furthermore, this review notes that removing devitalized tissue helps reduce bacterial burden and biofilm, minimizing the risk of infection. The DIME framework, DIME, as mentioned in the Stat Pearls resource, places or debridement of non-viable tissue within the wound as the crucial initial step in managing chronic wounds. Now, that JAMA dermatology study, while acknowledging the limitations of retrospective data, highlights its strength as the largest wound dataset analyzed to date. The results showed that almost 71% of the wounds healed, and wounds receiving weekly or more frequent debridement healed in a significantly shorter amount of time. This effect was observed across different wound types, although the magnitude varied. For instance, diabetic foot ulcers with weekly or more frequent debridement had a median time to heal of 21 days compared to 64 or 76 days for less frequent debridement intervals. While the evidence strongly supports the benefit of debridement, both the DOJ allegations and the clinical literature remind us that its application should be thoughtful and appropriate. The Stat Pearls resource that I mentioned outlines contraindications for debridement, stating that dry and intact eschars with no clinical evidence of underlying infection, such as in some unstageable pressure ulcers or heel eschars, may not actually require debridement. In these cases, the eschar can act as a natural protective covering, and debridement would be unnecessary and potentially harmful as well. The review in the Annals of Medicine and Surgery discusses the various types of debridement available, including autolytic, enzymatic, sharp, surgical, mechanical, and biological methods. And the choice of debridement should be tailored to the individual patient, considering factors such as the wound's characteristics, the patient's comorbidities, and pain management. The Stat Pearls resource also stresses that the mode of debridement should be tailored to the particular wound presentation, considering factors such as comorbidities, other low-risk options, and the patient's comfort and desires. The Annals of Medicine and Surgery review also highlights some newer debridement methods like hydrosurgery and low-frequency ultrasonic debridement, which have gained attention for potentially faster wound bed preparation and less pain. However, the findings on these newer methods are not as conclusive and need further investigation. Maggot debridement therapy is presented as showing consistent effectiveness in debriding chronic wounds. So, in conclusion, the question of whether wound debridement is overused is a complex one. The JAMA dermatology study provides strong evidence for the benefits of frequent debridement in improving healing outcomes. However, the allegations in the DOJ complaint against Vora raise serious concerns about the potential for inappropriate practices driven by financial incentives. It's crucial to remember that debridement is not always indicated, particularly in cases of dry, intact eschars without infection, or wounds that have already progressed forward from the inflammatory stage into the proliferative stage of wound healing. Furthermore, the selection of debridement method should be individualized, considering various patient and wound-related factors. So the landscape of wound debridement continues to evolve with newer technologies, but the fundamental principle of removing non-viable tissue to promote wound healing remains paramount. Healthcare professionals must adhere to ethical billing practices and prioritize the medical necessity of debridement procedures to ensure the best possible care for patients with wounds. If you have any concerns about your wound care, please consult with a qualified wound care specialist. And I thank you for tuning into WoundCasters by Wound Care today. Join us again next time as we explore yet another vital aspect of chronic wound management.